day everyone, I'm Joyce Apodurofan from BSN 212M. For today's video, I'm going to demonstrate the Leopolds maneuver. A Leopold maneuver is done to our pregnant patients and it usually performed after 36 weeks of gestation. So this is conducted in order for us to determine the position, presentation, as well as the engagement of the fetus and aid in location of the fetal heart sound. Additionally, this is done to help our pregnant patients to be prepared for their labor and to determine if there will be complications that will likely to develop during pregnancy or during the delivery, or if the patient will require a cesarean section. So prior to the conduct of the procedure, we will prepare the necessary materials such as soft pillow, a towel or blanket, and our stethoscope. And since we already have our needed equipments, we will now perform the hand washing or hand hygiene to ensure the cleanliness of our hands and to deter the spread of microorganisms. We will also protect our patient's privacy by closing the doors or draping the curtains. And now, let's greet our patient. Good morning, ma'am. How's your day?
It's good.
That's good to hear. So, I would like to introduce myself. I'm Joyce Apodurofan, a student nurse from Davao Doctors College. May I see your wristband, ma'am? Can you please state your complete name?
I am Eleanor Marie Ilumba.
And your birthday, please.
September 26, 2002.
Okay, thank you so much, ma'am. What would you like me to call you, ma'am?
Lee na lang.
Okay, Ma'am Lee. So for today, we will be doing the Leopolds maneuver. So basically, it is a technique we use for to determine the position of your baby inside the uterus. So what I'm going to do, ma'am, is to feel your abdomen and add a little pressure so that I can do the procedure effectively. Would that be alright, ma'am?
Yes.
So before we start, do you have any clarifications or questions?
And so far.
Alright, so before we start, ma'am, I encourage you to void first so that you feel comfortable throughout the procedure. So, it is important for our patients to empty their bladders before the procedure since it promotes comfort and allows for more productive examination. And if not, it creates a distended bladder that may obscure the fetal contour and slightly deblate the uterus. So if our patient is done voiding, we will assist them in a supine position with one pillow under their head. So ma'am, I need you to slightly flex your knee. Slightly lang. Right. So I need you to turn to your side, ma'am, and I will put pillow on your hip. So a flex is helpful since it relieves the tension in the abdominal musculature. And placing a small rolled towel beneath our patient's hip helps to prevent any supine hypotensive syndrome. So ma'am, we will begin the examination and I need to expose your abdomen. Would that be alright, ma'am?
Yes.
And if the patient is right-handed, stand at the patient's right while facing her. So make sure to only expose the area that will be examined to avoid unnecessary exposure. So first, I'll be doing the first maneuver, the fundus grip. So face the patient and use both hands to palpate the uterine fundus to determine which part of the fetus lies in the upper part of the uterus. So it may be the fetal head, which feels firm, hard, and moves separately from the trunk. And now let's proceed with the second maneuver, the umbilicus maneuver. So what I'm going to do is to palpate downwards on the side of the abdomen, but deep pressure using tip of my hands. So this is done for us to determine where is the fetal back. So the fetal back feels firm and smooth and has a hard resistant surface, and also to feel the fetal extremities, which feels like small irregularities. And for the third maneuver, which we call the Pollix maneuver. So to do this, I'm going to place my hand over the symphysis pubis and grasp the lower uterine segment with my thumb and fingers of my hand. So this is done to determine if engagement has already occurred. And for the fourth maneuver, which is the pelvic grip, so what we're going to do is to face the patient's feet and move our hands over the sides of the patient's uterus towards the pubis. So this is done to determine the degree of flexion of the fetal head. Since we're done with the maneuvers, we will now locate the fetal back and listen for the fetal heart tone for 1 full minute. So fetal heart rate monitoring is important for us to detect in the normal heart rate pattern during labor. So, ma'am, we're done, and I'm going to cover up you now. So, ma'am, are you comfortable?
Yes.
Alright, that's good to hear. So, ma'am, I have determined that your baby is at your right side and in a cephalic position, which means that the baby's head is at the lower part of your uterus and it is already engaged. So this means that your baby is at ideal position for labor, okay?
Yes.
Alright, so do you have any questions or clarifications before we end?
That's all.
Alright, so thank you for your participation, ma'am. Have a good day and stay safe.
Thank you.
So after performing the procedure, perform hand washing and document the findings of the procedure. So that's it for my Leopolds maneuver. Thank you so much for watching. Bye.